A question we get asked a lot, understandably, is what is the difference between a clinical psychologist and a psychiatrist? So a clinical psychologist is someone who specialises in talking therapies. They have initially done a degree in psychology and then often have gone on to do a master's or a PhD. And whilst they're doing this, they generally will gain as much clinical experience as possible. And then they'll go on to do their 3-year doctorate in clinical psychology. A psychiatrist is a medical doctor who, once they've completed their medical training, goes on to specialise in psychiatry. And their job is to primarily diagnose mental health conditions and then to provide medication and monitor that medication after. Lots of psychiatrists also do additional training in psychodynamic or psychotherapeutic modalities, and at the Edinburgh practice, all of our psychiatrists do have this additional training, and this makes it really helpful because we are a multidisciplinary team, and it means that if somebody comes to see a psychiatrist first, the psychiatrist is then really well placed to advise whether psychology or psychological therapy, in addition to medication, would be helpful. We know that deciding whether to see a psychologist or a psychiatrist can be confusing. So at the Edinburgh practice, we take that burden off your hands, where all of our referrals are reviewed by our clinical leads, and then we'll be able to steer you in the direction of which profession it's best to see first.